So I and Flinders would like to acknowledge and pay respect to the past, present and future traditional custodians and elders of this nation and the continuation of cultural, spiritual and educational practices of Aboriginal and Torres Strait Islander people, in particular the peoples of the Larrakia clan and country from where I'm sitting on here in Darwin, the Boonwurrung Nations, part of the Kulin Nation group where Shilpa is zooming in from in Victoria, and Timothy's joining us from Ghana country down in South Australia, Adelaide. So I'd like to acknowledge and pay my respects to all those clans and from anywhere else that our attendees may be listening in from. I'm very proud to be facilitating this series of medical career pathway webinars, which is a collaboration between Flinders Regional Training Hub, Top End Health Services, the specialty colleges and respected MT clinicians. Today we're joined by the Australian and New Zealand College of Anaesthetics to promote anaesthetic training pathways and opportunities for training in the Northern Territory. So we're going to have two presentations today from Shilpa Walia, who's the Acting Operations Manager for the college located in Melbourne, as I said, and Dr. Timothy Wonders, who's a current final year anaesthetic trainee and is currently in Adelaide, but has spent a significant amount of his undergraduate and fellowship training in the Northern Territory. So I'll be looking forward to that. And as I said, we'll have some Q&A availability after that. So without further ado, I might stop sharing my screen so that we can welcome Shilpa Walia to give us all the ins and outs about applications for anaesthetic training and what the training environment's like. Thank you, Shilpa.
Thank you, Olivia. Good evening, everyone. I'm here to present the information about ANSCA training program to you all. To start with, I would like to give you an outline of what I will be covering in today's webinar presentation. Of course, it will be more focused around what the training program is about, the opportunities and the training sites in the NT and SA region. So a little bit about ANSCA. So Australian and New Zealand College of Anaesthetics is a professional organization for about 6,400 fellows, and we have 1,500 trainees, which do keep changing every year. Along with our Faculty of Pain Medicine, we are responsible for training, examination, and accreditation of anesthetists, as well as pain medicine specialists, as well as maintaining the standards of clinical practice in Australia and New Zealand. Our mission is to serve the community by fostering safety and high quality patient care in anesthesia, perioperative, and pain medicine. Here is a glimpse of our ANSCA Melbourne head office and the Ulimaro Heritage Building, where I'm based. Coming to the training program, the ANSCA vocational training program is for a duration of 5 years, which we basically split up into 4 core units. And at what point can you enter the training program? So as a pre-vocational medical education trainees, you will have to undergo a trainee selection process, which can start when you have completed your 2 years or 104 weeks of your pre-vocational medical education training. And this trainee selection process happens at the different hospitals, or we call them as training sites across Australia and New Zealand. The college directly is not involved in this employment and placement process, but we do have some guidelines for our training sites, which they have to follow to receive their accreditation. As I said, the number of trainees keep varying a bit every year. So currently we have 1,600 plus trainees and approximately 350 plus supervisors. So what does the training program look like? So as I said, it's split into the 4 core units. We have the introductory training, which is for 26 weeks, followed by basic training for 78 weeks, advanced training for 104, and the last year of training, which is more like of a preparatory phase for your specialist consultant roles, which is a provisional fellowship training year, and followed by awarding of your fellowship to the college. How do you apply for the training program? So basically, it's a two-step process. First, you can become an applicant with the college, for which you need to have completed at least your 52 weeks of PMET, and you need to be a registered medical practitioner. You can become applicant and stay as an applicant for a period of maximum 2 years. And at any point of time, you can move on to step 2 of the process, which is registration. Definitely to register with the college and to actually start your training, you should have a training position with one of our accredited training sites. One of the key things which I would want to highlight here with PMET is out of your 104 weeks of PMET, at least 52 weeks of your experience must have been in areas outside of clinical anesthesia, intensive care, or pain medicine. What governs our training program? So we have a training program regulation, which is like a rule book called Regulation 37. We have our curriculum, which details the learning outcomes and the requirements of our training program across the 4 core units. And then we have a handbook, which kind of is a policy and process document for our trainees and supervisors. Talking more about our curriculum, the 3 key themes of our curriculum, which was revised in 2013, includes the ANSCA roles in practice, the clinical fundamentals, and the specialized study units. As you can see in the slide, ANSCA's role in practice span across the entire training program, whereas the clinical fundamentals and specialized study units are more focused in the introductory, basic, and advanced training period. In terms of the roles in practice, the main reason of the redevelopment or redesign of the curriculum, the emphasis was more around allowing our trainees to be more professional across all the areas of medical expertise, whether it's being a communicator, a collaborator, a manager, or a scholar, or a health advocate. The clinical fundamentals are more focused around the knowledge and skills which are required as an anesthetist and which will help you to become experts in the areas of practice. And then we have the specialized study units that actually define the skills required for managing particular areas of specialty like perioperative medicine or hyperbaric medicine, retrieval medicine. I'm not going to talk through all the details of the clinical fundamentals, but there are 7 clinical fundamentals and there are 12 specialized study units, which the assessments related to this are linked to the learning outcomes, which trainees will be covering during their different core unit reviews in IT, BT, and AT. Going a little bit more into the details of the structure of the training program, as I said earlier, you enter the training program once you have done your 104 weeks of PMET, and there is a selection process, which is carried out by the training sites, and then you complete the introductory training where you will be doing the clinical time along with volume of practice, workplace-based assessments. A core unit review is like a checkpoint, which will kind of determine your progression to the next training period. So once you have done your introductory training and completed the core unit review, you move on to basic training. And of course, the key component to progress further is the primary exam. So during the entire training period of 260 weeks, we have 2 examinations, the primary exam, which happens at any time after IT and before you progress to AT, which is the advanced training period. And then in advanced training period, at the end of it, or any time within the advanced training period, once you're eligible for sitting the final exam, you have to complete the final exam, and that will kind of determine your progression to the final year of training, which is the provisional fellowship training year. In the provisional fellowship training year, you have the opportunity of picking up any specialized area you would want to, either from the clinical fundamentals or the ANSCA's roles in practice. And you have a defined study plan, which you can prepare from the hospital or the training site where you will be undertaking the fellowship. And the other key thing about the PF year is you have something called clinical support time. So it's not necessary that provisional fellowship year is focused on clinical work. You also have non-clinical work, which could be research, audit, or quality assurance kind of activities. And you also do some continuing professional development in this year, which is associated with supporting your junior trainees with workplace-based assessments and other types of assessments. Now, how do you record or how do we capture all the training which our trainees do? So we have an online training system called the trainee portfolio system. It is a depository of our training data, and it's a place where trainees record all their training, and the assessments are completed by the supervisors. And at the same point of time, from the college, we kind of monitor the progression of the trainees through the data or the information which is saved here by the trainees and the supervisors. A very important question is, where can you do the training? Just to kind of give a broader perspective, ANZCA has 162 accredited training sites across Australia and New Zealand. These training sites are the hospitals which apply for accreditation with the college, and the college has a review process. And based on the hospital size and the case mix and a lot of other parameters related to assessment, there is an accreditation time limit for each of the training sites, which spans from 26 weeks to maximum 156 weeks. In particular, in SA and NT, we have 13 ANZCA accredited training sites. And here is a kind of the hospitals which are there within this jurisdiction. Thank you. Supporting the ANZCA training program. So we have supervisory roles within the training program because, of course, these are the people who actually are the first point of contact for our trainees. And first key role there is the supervisor of training. They are responsible for supporting you and providing you all the required guidance during the actual training and assessment process and during your progression from one training stage to the other next training stage. In addition to that, we have rotational supervisors. As I said earlier, most of our training sites come under rotation scheme. So the rotation supervisors kind of ensure that when trainees are put in placements in this rotation schemes, they do get enough of exposure required to different areas of clinical expertise which are required for them to complete the training. We do have another special role of supervisor, which is education officer. There is education officer allocated for each state or region, and they are kind of responsible for providing support to the supervisor of training and even to trainees who need any extra support. From the college side, as an administrative process, I would say Melbourne is the main head office for ANZCA, and what do we manage is in the training and assessment team of the education unit is providing support to all our trainees as well as supervisors to run and deliver this training program, as well as manage any application process related to trainees during different stage of their training. And of course, the key component is coordination of the examination, the two exams which I mentioned, the primary examination and the final examination. And in addition to that, we do have regional offices, and for SA and NT, we have a regional committee. The role of the committee is more around conducting different events and courses for our trainees and fellow, and even supporting our trainees to do the exam preparation courses. And I'm sure Timothy will cover more about this when he talks about the local support. Another thing which I would want to highlight here is we have a special scholarship for Aboriginal and Torres Strait Islander students, which is through the annual scientific meeting of ANZCA. It's a yearly based kind of a process, and pre-vocational doctors can apply for this. Other than that, we have a special kind of process where we provide career tips to Indigenous pre-vocational doctors, and they can get more information via sending any questions or queries to indigenoushealth@anzca.edu.au. Other than this, other than asking questions at the end of this webinar, you can direct your questions to the training team at the ANZCA head office, which is training@anzca.edu.au, or you can even send your questions to our regional office. I have included some useful links to the application and registration process and more details on the 2013 training program for future. Thank you. Thank you.
All right, thank you very much, Shilpa. I do have a couple of questions for you just before we go too far ahead. With the pre-vocational medical education training, the PMET, you said it was 104 weeks.
Right.
Were there any specific prerequisites that need to be done in that time in order to get onto the training program?
Right. Olivia, it's basically, as I said, one of the only key thing which I would want to highlight there is within that 52 weeks, 104 weeks, if 52 weeks can be done in any other clinical area other than anesthesia, pain medicine, and intensive care, that's the key thing. Other than that, just 104 weeks of PMET is the minimum requirement.
Yeah, so 52 weeks should be done in anaesthetics, pain medicine, or intensive care, and the other 52 weeks can be done in any other field. Yeah, okay. And we have another question which I thought would be better to be answered now. It's about research and whether research requirements, there is a research requirement throughout training or as part of the application.
It's a very good question. We don't have any research requirement as such for meeting the eligibility criteria to register for the training program. But however, of course, there are different components of our training which do allow trainees to undertake research projects or research programs at different stage in their training.
Okay. And one more question. So going on from the PMET, the introductory training, so does that need to be done in an accredited training hospital that's got accredited anaesthetic positions?
Yes, that's right. Any training to be counted or accrued towards the ANZCA training, definitely it needs to be done in an accredited site. One of the thing is the provisional, because you've asked this question, it kind of triggered another thought in my mind. Provisional fellowship training here is slightly different. Like trainees do apply for overseas or in any other specialty other than anesthesia, and they can undertake that training year in those hospitals or those training sites. However, they have to seek approval prospectively related to those study plans.
Okay, great. Thank you very much. I'll save all the other questions for a bit later. So we'll see what Timothy's got to say. So now I'd like to hand over to Timothy Wonders to talk to us about his training journey and all the exciting things he got up to into the NT, I hope.
Thank you very much, Olivia. Can you see that screen coming through there?
Yes, we can.
Perfect. So the slides are just the background to gain me some Northern Territory currency. Most of the information, guys, will be coming from spoken word. Just to introduce myself, I'm in my final year of anaesthetic training. Waiting to sit my exam, which unfortunately has been delayed due to current world circumstances. But I'm currently training in Adelaide, where I've done most of my anaesthetics training, but I've done quite a substantial amount of time through the Northern Territory Clinical School and Rural Clinical School. Did most of my third and fourth year at Flinders, working at every site other than Tennant Creek, and spent several months working in Alice Springs as a medical registrar, as well as 6 months working at Royal Darwin in 2018. I guess it's a pretty simple task for me today. One is to sell you anaesthetics as a career, as both a trainee and as a long-term practitioner. I'll let you in on they'll give you a shortcut in so that you can know some of the difficulties of training as well, but also make sure that you're reassured that those things shouldn't stop you from partaking in the training if that's what you want to do. And then I'll talk a little bit about how all of that applies to the Northern Territory. So anaesthetics as a career it's really one of the best jobs that I can imagine, and hence why I'm doing it. Obviously, I'm totally biased. But I think if you consider the people that you see around the hospital, anaesthetics, along with probably ED and the ICU doctors, we're probably some of the few multi-organ specialists left in the hospital. And in terms of people who have day-to-day hands-on procedural and technical skill ability, that if you consider those things, the field drops down pretty quickly. So if you want to be able to retain multi-organ reasoning and thought processes, anaesthetics could well be the place for you. I also mentioned the potential to undertake procedural work. We are always hands-on, and indeed, when we have a responsibility to a patient, that is our patient until they are no longer our responsibility. And there's not many other specialties in medicine where you get to be so patient dedicated and orientated. The knowledge and skill sets that we have and understanding span across the entire spectrum of in-hospital and out-of-hospital medicine. We need to have good background knowledge in all medical and surgical fields. And as I said, that allows us to look at a patient as a whole organism. It's not just your in theatre time. It's not the time that you spend in theatre sitting on your chair waiting for the case to finish. Anaesthesia as a career spans the entirety of perioperative medicine, and indeed many days after a surgery, with the input of the pain teams and pain units. And if patients are unlucky enough to have chronic pain, then they may also be seeing anaesthetists completely unrelated to any surgical procedural intervention. The spectrum, of course, of anaesthetic practice can span outside of the hospital. We have our skills and knowledge sets are sought after in a range of different fields. In terms of out-of-hospital work, working as a retrievalist, or working for organisations such as the Australian Defence Force, anaesthetists will almost always find work in those areas due to the things I've already mentioned. The other great thing about anaesthesia as a career, if you're already seeing from some of my photos, is that it does allow you an opportunity to develop a work-life balance and gives you flexibility. And those are two different things in reality. The work-life balance means that you can control your work. It means that come the end of the day, there are systems and organisations and within your departments that you work in, you'll have the availability and opportunity to hand responsibilities on to people, which allows you to go home and rest comfortably. Which sounds like a minor thing, but most major departments will have in-hospital registrars around the clock, so you can always rest assured that your patients are going to have immediate access to anaesthetic care if it's required. On top of that, the flexibility, which I mentioned, because we are not responsible for developing practice and clinic hours, and we're not responsible for the long-term continuity of patient care. If there comes a time in your life where you need some months off, or you want to change and you're going to take a year of leave to travel or to practice elsewhere in other circumstances, you might well be in a position where you can negotiate that with your workplace. And that means that you can go away, you can enjoy other things that life has to offer. And that means that you have that opportunity to take your skills and knowledge and work in other parts of Australia or other parts of the world, and giving you some portability. The other part about that, obviously, is that you know, again, with all biases declared, I think that the ANSCA training program and working as an anaesthetist in Australia is held in quite high regard throughout the world, and so provided your language skills are up to speed, there are all sorts of opportunities available to you around the world. So a couple of the other thing, too, is that anaesthetics, you can be as broad or as subspecialised as you like. There are, you know, there are the range of practices that anaesthetists can get up to is really quite broad, and you can try and stay general and work across a range of specialties, or you can specialise into particular subspecialty areas. Some of the bad things about training in anaesthetics, I can tell you some of the things that have already come up in what I've spoken about, and one of the things that I was a little bit worried about before I started my own training and work as an anaesthetist is the loss of potential patient continuity and also the loss of the patient interaction. We are, after all, rendering a patient unconscious predominantly. And for people who enter medicine, that can be a fairly valid concern. You know, we primarily do it because we are interested in people. We enjoy exercising our patient-related skills, and considering that you might lose those, or that you may not have as much opportunity to practice it, could be a hurdle to you entering anaesthetics. But I'd reassure you, because if I put you into the position where you need to meet a patient for the first time, and you have 5 minutes to both get to know them, understand their fears, and allay those fears, build trust and confidence in your ability to do the job that they want you to do, all whilst taking a detailed medical history and formulating a plan which is tailored to that patient. To do those things, you need to be highly skilled at interacting with patients. You need to be highly adept at dealing with them how they wish to be dealt with. And I can tell you that there's no loss of the benefit of patient interaction, because you really, it hones those skills and hones the time course for which that happens. Secondly, you know, there's sometimes in anaesthesia there's a because you're not the primary point of patient care, and patients may not necessarily have a good understanding of what you do or who you are when you meet them for the first time. They might ask you, are you a doctor, or are you the person who puts me to sleep, or something vague and generic like that. And there's always a chance that people feel a little bit underappreciated or misunderstood, and I don't really have some way to reassure you about that, because there is that possibility. But I don't find that that's an issue for myself or for anyone else, any of my senior colleagues. Most of us find the enjoyment out of knowing we've helped the patient get through whatever is troubling them, or for whatever reason they've come to us. That's fulfilling enough. The training and practice of anaesthetic can be very stressful. It's a job that requires it entails a lot of responsibility, and you can be looking after sick patients. You can be looking after sick patients after hours in remote conditions, and all of these things can be quite taxing on your mental processes. And I won't hide from you the fact that some trainees find it very stressful, and indeed it's something that our college works very hard at to try and alleviate. So there are a lot of college and trainee structures in place to help people with the emotional burden and the responsibility burden and the mental toll that can take, both through training and also through the other side. And it's something that I know myself and a lot of my training colleagues are very appreciative to ANSCA for that. Entailed in that stress is the exams. They are pretty brutal exams. All of the specialty exams across medicine are, but the ANSCA exams do take a little bit of the cherry there. They're fairly well renowned for being tough exams. but they are fair exams, and they're formative exams. They do help you get to where you need to be to practicing what is a tough specialty. And finally, the rotational setups of many training sites mean that you do need to move, but that's pretty consistent for most training specialties. So how does all of this relate to the Northern Territory? So the Northern Territory has a few opportunities for practicing anaesthetics, and for someone who theoretically wants to do as much of their training time in the Northern Territory as possible, I think probably it's possible to do about 27 of your 60 months in the Northern Territory. Two rotational training programs, both QUIATs and SANTRATs, that's Queensland and South Australia, have rotations of trainees going to the Northern Territory, to Darwin. SANTRAT sends up trainees for 6 months, and that's in the ET, AT years, so somewhere after your primary examination but before your fellowship exam. And QUIATs, the Queensland rotational scheme, sends across introductory trainees. QUIATs go for 12 months, and so in theory, if you went across, if you wanted to stay in Darwin for as long as possible, you could enter the Queensland rotational training program, be in Darwin for 12 months. By negotiation, you may also be able to do 3 months of ICU there, and then potentially return for training time in your PFY year. But by necessity, you would have to leave Darwin for some of your training, and the reason for that is some limited availability of subspecialty work, as well as the requirement to meet volume of practice requirements in those subspecialties. In Alice Springs, there is a department who I know train. They have some GP trainees and some ICU trainees, but at this stage, last time I checked, there was no ANZCA trainees in Alice Springs. The other benefits of Darwin, if my photos, presumably most of you have in some way Darwin or Northern Territory related, so most of my photos are probably looking like pretty good touristy shtick. But if the local benefits aren't enough to get you to stay in the Northern Territory, my own experiences in working at the Royal Darwin Hospital were of working within a fantastic department that's very functional and very orientated around positive training experiences and positive patient service delivery. You get a great opportunity to practice medicine across the spectrum with some very interesting patient pathologies. On the downside, as we've already said, you do need to leave Darwin for some of your training, and you do miss out on some of the broader scope of practice up there. But the patients that you do see there are unrivaled in terms of managing complex medical issues and perioperatively. Briefly, in terms of applying to a training program, as Shilpa was saying earlier, PGY3 would be the earliest you could enter training with certainty. In reality, you need to obtain a training position job with a department or with a rotational scheme. If you approach a department directly, you can enter in as a non-rotational trainee. Alternatively, if you join the regional training program, then you will be rotated around sites as appropriate for your training across the 4 years of your training pre-PFY. In terms of your PMET, your pre-vocational training, the more the better, and the broader the better, I think. My own journey, obviously, I had about 4 years as a resident before starting my anaesthetics, and I am thankful for all of that, mostly because that was very good for my personal learning. But it means now you have when you're going into the advanced years of your anaesthesia training, you do have an overall coordination insight into other areas of the hospital where you may not if you enter straight after your second year out. So that's probably all I have to say about anaesthesia in general. There might have been some questions popping up. Olivia, are you going to be doling out those for us, or?
Yes, I will, Timothy. If you've summed up there, you might like to stop sharing your screen so the audience can see us. You answered one of the questions quite fully, actually. One of our listeners had asked specifically about how much training can be done in the Northern Territory. And if I might take the liberty of summing that up, I think, and Shilpa might be able to confirm or deny. So if you join the Queensland training, which has a training network with the NT, in the top end, you can do up to 24 months of training in Darwin, which includes some of the introductory training, basic training and advanced training at different times. Is that correct, Shilpa? You're on mute at the moment.
Sorry about that.
Yeah.
So yes, so as Timothy said that it's not possible for a trainee to complete the entire training in one rotation or at one hospital, because every hospital has a different maximum time limit duration. So I can direct you to the actual section. We have a rotation and training site limit web section where we kind of spell out exactly how many weeks can be spent at each and every hospital. So I will definitely have to check in terms of how many exact weeks it will be, but maximum it could be IT, BT, or mid of 80, because basic training, and sorry if I'm using this abbreviations, but yeah, introductory training, basic training, and advanced training. So for basic training, it's for 78 weeks, and introductory is 26 weeks. So that adds up to 104 weeks. So most of the training sites, if you add up, even if there are 2 or 3 hospitals, like we have Royal Darwin and we have Alice Springs, and if you add up those hospital time durations, the trainees should be able to complete at least their basic training and some of their advanced training, but after that they will have to move somewhere else to complete the rest of their training. One thing which I would like to add in there, provisional fellowship training year doesn't count into the time limits of the hospitals, which we have mentioned. So the trainees, if they have a good opportunity, say for example, Royal Darwin has quite a good provisional fellowship study plans, so the trainees can go back there to complete that last year of training.
Well, that's excellent news. And I believe for Central Australia, they've only got accreditation for about 6 months of basic training, and that's about all you can do in Central Australia. Is that correct?
So it doesn't go as in general to Central Australia. It varies from individual hospitals. So depending on which hospitals come under that jurisdiction, it will vary. Yeah.
And that's mostly the SANT jurisdictional contacts, is it?
Correct.
Yeah.
Correct.
Okay. Just sorry, lost my train of thought. We have one question that came up in the Q&A box about someone who's interstate who might be interested in coming to the SANT Anaesthetic Training Network and what the best approach for them might be. I'm kind of excited that we've reached New South Wales, but we might just answer that one online so everyone can hear the answer to that, if you don't mind, Shilpa.
Yes, so I have kind of explained that basically it's up to the training sites or the rotation schemes. Timothy mentioned a very good point that it's not necessary that you have to enter the training program via the rotation schemes. You can, if you get a placement at a hospital, you can become an independent trainee, and then at some stage, as and when you get an opportunity, you can jump into the rotation scheme. But basically what the prospective trainee will have to do is contact the training site or hospital to find out how they can go ahead with the employment or gaining a position as a registrar, and then they will have to come to the college for the actual registration process.
So if we had some people interested in anaesthetic training in the NT and listening tonight, who are the local contacts you would recommend that they get in contact with if they're local?
So I can't give exact names, but what I can say, they can contact the Department of Anesthesia of the hospitals which we have in the NT region, and the supervisor of training or the head of the department are the people who have more idea and knowledge about the opportunities which will be coming up. The second thing is they can also visit the hospital website about the vacancies as anesthetic registrars, and that will provide them information about the respective hospital positions.
Okay. Timothy, having done some placements up here, are you aware who the local contacts would be for Central Australia and the top end?
So at Darwin Hospital, essentially making contact with the department, either the assistant director or director of the department is the best way to go. In Darwin, Dr. Brian Spain is the head of department, or was up until recently, as far as I recall.
Yep, still is, yes.
Still is, fantastic. Although Dr. Spain is incredibly busy, so don't feel slighted if you're not able to get in front of him. Any number of the senior anaesthetists up there would normally be able to give you some insight into the ways to go about that. I mean, anaesthetic placements as residents are normally pretty popular. Even for people not wanting to do anaesthetics in the future, you do normally as a resident in anaesthetics, you'll get pretty, a fantastic exposure to new technical skills, airway skills, and the ability to practice those things with expert teachers in a one-on-one fashion. So even with people aren't keen on anaesthetics as a career, if they're keen on ICU or ED or rural general practice, there's all sorts of professions which benefit from some time in anaesthetics. So placements as residents are quite sought after. So the best way always is to approach the departments and talk to them and say, hey, look, I'm interested, and what can I do to get my name, on the list of people, so to speak. I know that's a really good way to approach it in South Australia. We have about 4 or 5 hospitals which will offer rotations to residents, and typically it's best to go about contacting those departments directly.
Yes, I know in the Northern Territory, training positions as a junior resident are very sought after in the anaesthetics departments. And there's lots of competition between ED trainees, intensive care trainees, anaesthetic trainees, GP trainees doing their advanced training in anaesthetics to be GP anaesthetists, and those who are wanting some anaesthetic experience for working out in rural and remote locations. So it's really good to get in contact with the heads of departments, as both Shilpa and Timothy have suggested. And also take advantage of that. If you don't feel like you have that connection, the medical education officers at each of the hospitals in the territory can organise a bit of an introduction for you as well. We do have Lincoln Hoy online as well, who sent some information to us about contacting the regional committee, and Shilpa mentioned the SANT regional committee earlier, and gave us some contact details for that as well.
I'll say very quickly, Olivia, people don't get too hung up on gaining that PMET experience in anaesthetics. It's not, from memory, there's not actually any prerequisite to have experience in anaesthetics to apply. So if you have relevant parallel experience in ED, ICU, those things will still be considered. It's probably still tough to get a placement in a rotational scheme, but not impossible. And so it's not, anaesthetics is not like some specialties where you need, several years of unaccredited pre-vocational training to get yourself into a training program. And indeed, probably my own experience is getting in with about 12 weeks of experience as a resident. And I think that's probably where most people sit, maybe 3 to 6 months as a resident / registrar, borderline practitioner, but before they get into a training program. And I know there are people who have gotten in without any actual anaesthetic experience. So don't get too hung up on that per se.
It's really reassuring to know that you don't have to rush. I think there's a lot of pressure on pre-vocational doctors now to feel like they have to get onto a training program quickly. So it's really refreshing to hear someone say that, do as much pre-vocational training as possible, explore who you are as a clinician, get lots of experience in lots of different hospital departments, and the broader your experience, the better you will be once you get onto the vocational training. But we do have one question just on that though. So earlier it was said that that there are hospitals that offer training positions, which we're aware of. Would that mean you would have a better chance of gaining a position if you were working at one of them as a PGY 1 or 2?
Yeah, I think the answer would be yes. I can only answer from my experiences around. So in South Australia, as I was saying before, if you have the opportunity to work in the hospital and to approach the department as an employee at the hospital and say, I'd like to come and work in your department, you're going to have a bit more success.
Good, excellent. It kind of makes sense that you'll be more connected if you're part of that system. But certainly we've heard lots of good ideas about how to let yourself be known and get to know people by contacting the heads of departments and the regional training committees and stuff, if you happen to be wanting to come from a different jurisdiction, just to get yourself known that way. And I imagine across the country, anaesthetists tend to know each other as well, especially heads of departments and stuff. So talking to your own regional heads of departments, they'll probably know somebody in the region that you're going to and may be able to organise a personal introduction as well. It is a small community when you think about it right across Australia. I was just wondering, Timothy and then Shilpa, you said there's about 1,500 trainees at any one time right across Australia and New Zealand. I was just wondering, Timothy, from your perspective, what support is available for trainees, not just the education component, but what other support do you get from the college?
So again, we're very lucky in this regard. The college offers quite a lot of support from both the central point and also at regional offices. So in terms of non-clinical support, each hospital which is accredited will have an appointed, obviously, supervisor of training who's responsible for the training side of things, but also welfare officers who are available to help with issues of welfare. And there's quite a lot of guidelines that the college put into place to help ensure that conflicts of interests are not exercised, and that there's good scope for confidentiality and assistance for trainees who need it. Centrally, as I said before, the college is always working on welfare, not only for trainees but for fellows as well. It's an ongoing project for the special interest groups, the welfare special interest group. And then in terms of non-welfare support, the college library is probably the best health access library I've had experience at. And as I said, I've been to a lot of hospitals and had access to a lot of different health libraries. And I think the ANZCA library is probably stands over those. No offence to Flinders. But it offers very good support for trainees and for fellows, both remotely online, but also in person. I'm sure there's lots of other things Shilpa may want to add to those things, but as a trainee, those are really hit the big ticket items for welfare and training.
And no offence taken on behalf of Flinders. It's always great to have access to a wide variety of resources and a good library. Shilpa, was there anything else you wanted to add?
Yes, I would just, Timothy has well explained what welfare and non-welfare support and resources are available from the college and from the regional offices. One of the key things is we have a trainee wellbeing program, doctors wellbeing program, I should say, not trainee wellbeing, doctors wellbeing program, and we have special counseling, professional counseling helplines which are available for our trainees if need be, and trainees can have access to that. And in addition to that, we do have welfare advocates at departments, and most of the hospitals do have, and we are in the process of compiling all the information of welfare advocates across all our hospitals, and they are kind of a support system for our trainees other than their supervisor of training and their educational officers for their regions. And as Timothy mentioned, our library is a very rich source of knowledge related to anesthesia, access to various journals, articles, any information or anything related to the field. You will find the information in there, and our trainees and applicants as well can access to those resources.
Yeah, great. Thank you very much for that. It's always nice to hear that there's lots of support in process for trainees who are embarking on, at a minimum, what's a 5-year training program. So that's really good. Before we came on, we've talked about trainees applying to come on in terms of maybe coming from interstate and getting jobs and stuff. Once you're on a training program, do you have to stay within that jurisdiction, or is there some flexibility with crossing over to different jurisdictions around Australia and New Zealand?
Timothy, go ahead. If you...
So certainly there's no requirement to stay within any rotational scheme, or on a rotational scheme. So the benefits of the rotational schemes are that you do get a little bit more. Well, you get a different, slightly different support from the regional officers, and also it takes care of rotations that provide you with access to your subspecialty training. So here in South Australia, we have a couple of tertiary hospitals, and then some smaller hospitals, as well as a women's and children's and obstetric hospital. Without being on the rotational program, it can be difficult to get subspecialty training in paediatrics, cardiothoracics, neurosurgery. Whilst you would accumulate most of the training that you need for most of your other areas, to do those particular areas, you typically need to be on a rotational scheme. So that's where the benefit comes. Otherwise, you can stay as a non-rotational accredited trainee, and then you deal directly with the college with regards to your training progression. But also that doesn't preclude moving interstate or somewhere else.
Okay. Anything else to add, Shilpa?
Yeah, as Timothy has already covered that, but just to add, like we do have, from my experience in my tenure at ANZCA, I've seen many trainees moving not only within regions or states in Australia, but moving from Australia to New Zealand, or coming from New Zealand to Australia to complete part of their training. So as long as, as from the college point of view, we don't have any restrictions on where trainees can move or where they can complete their training, as long as the training site, they haven't reached the maximum training time limit at a particular training site. So it's all good. Thanks.
Great. Thank you. That sounds very flexible, and I'm sure that will be appealing to many potential trainees for the future. I'm very well aware of the time, so we've got 3 minutes left. So I just thank Shilpa Walia and Dr. Timothy Wonders for joining us this evening and inspiring us all to embark on a career in anaesthetic training. I might even jump ship one day, maybe. And thank you to our participants for all your questions. As I said, this is being recorded, so it will be available for everyone who's listening tonight to view, and those, if you want to share the link with anyone else who you think might be interested in training across the NT and interstate. So all the presentations will be available on that recording as well. I know Shilpa had lots of information in her presentation and lots of contact details as well. I will just share my screen one more time, just in case you can't get hold of Shilpa with her details. There you'll find the Regional Training Hub's details on the screen as well. So feel free to email or contact us. We've also got a whole lot of career pathways information for NT residents covering all the specialty colleges. So feel free to look at those and all the details for the different hospital contacts as well for all the specialty training areas. I do have a quick 3-question poll for all of our participants to answer. So that should be coming up on your screen now. It's just 3 quick questions, if you wouldn't mind just ticking the box on those while we're doing that. And yes, and those of you who are up in John Hargrave's room with Abdul, he's got paper copies of that poll for you just to fill in as you're leaving. So thank you very much for bearing with us this evening. I hope you all have a wonderful evening, and I hope you stay warm down there in Melbourne and Adelaide. Thank you very much.
Thank you, Olivia. Thank you, everyone. Bye.
No worries. Good night.